Good morning, all. I am Michaela Armstrong, and today we will be discussing the moral right to healthcare. As most of us are already aware, healthcare and the access to sufficient healthcare continues to be an issue that will remain at the forefront of reform. From the financial strain to receive care to the lack of access and the low quality of care, the debate on healthcare persists. As the hospital compliance officer, it is vital that I explain to everyone some of the elements in which are essential to this issue. So we're going to move on forward to the important elements. The important elements include the code of ethics, the cultural competency, resource allocation, and Stark law. To begin, the code of ethics. First, the code of ethics, when we discuss code of ethics, there are many things that surface and come to mind. The code of ethics is essentially what guides medical professionals to act and handle situations in a professional and ethical manner. According to Bastillos, a code of conduct is an opportunity for an organization to define its perception of successful human interactions. The Hippocratic Oath is another example of code of ethics, and according to Markle, the Hippocratic Oath stated, I will neither give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect. And this is just another example of what a code of ethics could be. And saying that the code of ethics is nothing that is standardized. This is something that's personalized based on your location and the facility that you're at. The next element that we're going to review is the cultural competency. Cultural competency is the ability for an organization or people to effectively interact with people of different cultures. This entails being respectful and sensitive to health practices, beliefs, and concerns, regardless of personal understanding or belief. Cultural competency is important because many times medical facilities will serve a wide array of patients. The diversity within those patients can be very significant. In order to be sensitive to each patient, no matter their culture, all staff must understand cultural diversity and acceptance. As everyone is different, healthcare facilities and workers must aim to treat all patients as individuals. The next element is going to be resource allocation. So, four forms of resource allocation is the expert panel, community consensus, lottery, and court order. So expert panel pretty much is what it says. It's a panel of experts that will allocate the resources. Community consensus is pretty much getting information from the community on what they feel is most important, what their needs are. And then lottery, pretty much throwing everything in a basket and just pulling who gets what. Court order is essentially just what it says, getting a court order to allocate funds. The next element that we're going to talk about is the Stark Law. According to Higashi, 2017, Stark Law prohibits a physician from referring medical or Medicare patients from designated health services to an entity with which he or she or an immediate family member has a financial relationship, unless an exception applies. There are countless laws that govern the operations and fundings of medical facilities and organizations. The Stark Law, I feel, is one that changed the way in which business took place. The Stark Law, in a nutshell, prevents physicians from referring Medicare patients for care services at another entity in which they receive financial relationships or financial gains. So this essentially prevents the illegal acceptance of government funding. In conclusion, we've talked about the four elements that are important to the moral ethics or morality of healthcare. And those elements are the code of ethics, also known as the code of conduct, culture, competency, resource allocation, and the Stark Law. The final slide is the resources used for this assignment. Thank you.